Welcome to episode 14 of Beyond Zero's podcast. Coming up,
E-pharmacy is...
Welcome to the Beyond Zero podcast. My name is Lebo Molax, host with the most, MC with the best, the Boza MC. Coming to you, of course, live in love and absolute beauty, all the way from East London in the Eastern Cape, South Africa, brought to you by BZAT, Beyond Zero. I am not alone. I do have a co-host right here, and I would like him to introduce himself.
Right. So my name is Luthando, Njeza, as you've seen on the TikTok video, and I am all the way from Cape Town. And thank you so much for having me here. I'm really excited.
I'm so excited to have you. Right, and I do have my guests over here. I would like you to introduce yourself. So you tell us your name, which organization are you from, and what do you do? Starting from my very immediate right. Please introduce yourself.
Good evening, ladies and gentlemen. My name is Lisabella Moshadisi. I'm originally from the Free State, Bloemfontein, but residing in Limpopo. I am from Pulse Healthcare. I work as a monitoring and evaluation officer / a transgender activist. Thank you.
Good evening, ladies and gentlemen. My name is Njeza Matlala, originally from Bloemfontein, the Free State. I work at Beyond Zero, one-stop shop, Bloemfontein. I work as an ambassador and I'm also a beneficiary. Thank you.
Good evening, everyone. My name is Rose Ross. I'm from East London. Yay, yay. Thank you. And I am from SHE, program manager, implementing the MSc program. Thanks.
Great. Welcome one more time. Are you guys looking forward to this conversation? Are you guys ready? Are you guys prepared?
Yeah.
Let's unpack. Right. So in today's episode, we are exploring how innovations like Key Population Hub, Key Population Helpline, and the e-pharmacy are changing access to the healthcare for key populations. These innovations are breaking barriers and making healthcare more accessible, inclusive, and effective. Let's get into how these are actually impactful and what difference are they bringing to the community. To start off, Mudise, what is a key population hub? Let's start there. For those who don't know, for those that haven't heard of a term key pop hub, what is a key pop hub?
A Key Pop Hub is a centralized safe space based in Bloemfontein. Basically, the services that we offer, the beneficiaries that we offer our services to are MSMs, TGs, sex workers, PROOTs, and we also offer commodities like condoms, lubes. We also offer internet for CV typing. We also offer services like PrEP. We initiate our clients on PrEP. We also offer HIV testing, STI screening, and psychosocial support services. Thank you.
So, in a nutshell, what you do is basically a virtual safe space. Am I correct? Basically a virtual safe space.
I think we are virtual in terms of social media, but we have a safe space, a physical safe space based in Bloemfontein.
Now, why is it so important to have a safe space as a person, just an individual? Why is that so important?
I think because we are diverse people. I mean, we have different needs. And not all of us fit in other spaces like public hospitals, and not all of us fit in other spaces like private hospitals. And I think since we are diverse, we all have different needs that we need to serve.
Thank you. Thank you.
Great. So, how do you then define e-pharmacy? I know we've got such things like email, But now we have e-pharmacy, ladies and gentlemen. What is an e-pharmacy? I don't know. Perhaps Lisa would explain that.
Okay. E-pharmacy is accessible way whereby you get your medication delivered to your doorstep. We're talking about your PrEP. We're talking about they have their website whereby you would call or you would WhatsApp. Then you go through a practitioner, go through the whole consultation with a practitioner up until you get tested. Even when they send your PrEP, they send with your test kit, your self-test, for you to test yourself, see that you are still negative, and then you can continue taking your PrEP. Yes.
Beautiful. Okay, so that's interesting. I think e-pharmacy is the best, because tell me, how do you think this will help in terms of, protecting our beneficiaries from being stigmatized, How do you think this could help?
It does help, just like CCMDD. CCMDD, it's whereby you take your chronic medication from your clicks, from your checkers, from your, you name them, from your DSCAM. It is protecting you from being stigmatized, because we know back in the day when you go to a clinic, you would find when they say chronics this side, they are basically avoiding that. Chronics this side, those with green cards, they are going for ARVs, these are for TB, these are for, so they are avoiding all of that stigma in our healthcare facilities. So it does help e-pharmacy.
Oh, that's interesting. Now, I heard that we have a helpline, Beyond Zero. No, it's actually Key Population Helpline. Now, tell me more about it. What is the helpline for? How does it help? Okay, let's start there. What is the helpline for? So that people can know when they call, the reasons why they should call. Why should I call this number? Why is it there? Why is it existing? Before we get to the services rendered.
Okay. I would say the helpline is for our key populations to get psychosocial support, because sometimes going into a physical consultation, it is much more harder. You tend to lose trust, because with key populations, we're talking about sensitive people. One wrong thing that you say, the person will just bring a wall in between, they will never open up. So it is very easier for you to open up to a person who's on the other side. You feel free, you feel relaxed, you feel comfortable. Now you can share what is bothering you, what you're going through, what is affecting your mental health. So I think even the helpline, it does help a lot, and for our key populations. Thank you, Lebo.
Great, interesting. So, ladies and gentlemen, as you've heard, Lisa said e-pharmacy helps with eliminating stigma. Now I've got a question for Mizola. Mizola Njeza. Mizola, how does Beyond Zero assist the key population who are stigmatized? How does BZ help them? I know that, we can help them psychosocially, yes, psychosocial support. But legal-wise, is there help? Mizola, are you there?
Hi, good evening, everyone. So how Beyond Zero helps, we have SRs implementing when they do document their human rights violations. They can be referred to access to justice, either by CAOs that are implementing on human rights at community level, or legal-wise that is also providing legal services on the ground. And our SRs do assist by providing follow-ups and just also assisting their clients right up until closure. Thank you.
Right, great.
So, the vibe I'm getting from these innovations, the Key Pop Hub, the Key Populations Helpline, right? I'm getting a vibe that they're sort of, you get what I mean? So, my question to you is, what are these innovations currently doing to help key populations sort of access better healthcare? Over to you.
Let me speak specifically to the e-pharmacy.
Okay. Just
Okay.
very closer days.
What about? Specifically with the e-pharmacy and how it actually benefits them. Where we are implementing the program, it's called the District Awartambo. That is very much rural. So the benefit of e-pharmacy is where a beneficiary would probably walk close to 5 kilometers to go to a health facility and accessing health services. Now through e-pharmacy, they get the medication on their doorstep. They would also save on transportation, having to go to a clinic, just to be able to access PrEP, and then not, obviously they just go for PrEP and not other medications, and now they have to pay transportation to access PrEP. They have to go sit in long waiting lines, and then now with the e-pharmacy, they actually get that treatment directly. They don't have to go and sit in the waiting room. They don't have to pay transport. They don't actually have to walk a distance. And clients who are also working, they don't have to take time off to come to the clinic because now they can get the medication directly.
That's very convenient for a lot of people not able to reach any. My mic's, I can't hear it. Okay.
Luthando's mic.
Yeah, is it fine now?
Yeah.
Okay. That's very convenient for people who are not able to reach any healthcare service, you know. Yeah, that's very convenient. Thank you so much for that.
Great. So, Mudisi, I am worried about e-pharmacy. It's e-pharmacy, man. E-pharmacy, does it have privacy? Because now I'm sitting here imagining myself, I'm expecting, for argument's sake, art. And I'm not home. And today is the delivery day, right? They have to deliver on my doorstep. And how do you ensure that what is meant for your client is reached by the client with no ziggy zaga zaga zaga, especially if it's art, you know? Yes.
Like it was mentioned, confidentiality comes first with the clients.
Okay.
That's the reason why e-pharmacy was launched and opened, because it was launched for a purpose of creating confidentiality, like not going to hospitals and not being identified. Okay, this client is going to get PrEP. This client is going to get art. I think that is the main goal, and I agree that it is a private experience where there's confidentiality and the client's details will not be shared or will not be seen by any other or anyone else. Yeah.
Okay. Yeah, you may add.
To add on that, you know, with courier services, you know, we have Abu Temu, we have Abu Take a Lot.
Yeah.
Then people would think, she bought or he bought from Temu, so they wouldn't even know that. Yeah. So it's a beautiful initiative.
I was about to say that. I honestly believe e-pharmacy is the best thing that could ever happen to people, particularly those who are afraid of stigma because of HIV. I can tell you confidently that we still do believe, we still have people that actually believe that HIV is the end of the world. I don't want to lie. There are people that still need support. Psychosocial support, first of all, which is what they can get through the helpline, and also receiving medication on time and receiving the medication that will help them with them feeling safe in terms of, I don't want people to really know about my status as yet, because we are different. We do have people. So there are people that are still scared of HIV. You know, they can't even disclose their status. And for that reason, it's killing them. Not because they're not taking medication. What's killing them is accepting the idea of having the virus. Now, with e-pharmacy, we are saying, be at home. We know your status. You don't need to come into the clinic, because at the clinic, we will see the kind of envelope that you are holding, why you are here. We will see what kind of medication you are here to take, because at the clinic, I am not saying clinics do not have confidentiality whatsoever, but I know one way or another, someone somewhere felt like, oh my God, that was too obvious. And guess what? It was obvious because of how the procedure is. Just the procedure of getting your medication. You are holding a green envelope. It's different from any other person's envelope. And how the nurse is talking to you. And how you have to walk out of the clinic holding sort of like a brown envelope. You know how it is, man. You can tell. So with e-pharmacy, we are eliminating that part. We are saying you will get your medication and we will in fact bring it to you. Beulah. Now, Miss Nokuduka. Nogoduka. How does the e-pharmacy model fit into pandemic preparedness? Pandemic can come anytime. We did not see COVID coming. It came just like that. If we could have another outbreak of a certain pandemic, how does the e-pharmacy model fit into this pandemic preparedness? Over to you, Miss.
Thank you very much, Lebo. I know you always do this.
That's how we greet. That's how we greet.
So on your question, remember e-pharmacy is a system. It's an electronic management system. So it has some kind of patient record storage facility. So in case of a pandemic, we will know that we already do have patient information. So either in case of a new disease or a case of a climate disaster, we will know that the patient information is stored safely. So that's one. Two, in case of a pandemic, for example, we all know during COVID-19, we then got locked down. So we access to facilities, access to health services, and access to treatment was then limited. So if you have an e-pharmacy, you can then be able to collect your medication without interacting with any human being that would probably transmit or infect you. Also, in case of a disaster, if the facility gets washed away by a flood, burnt by fire, the e-pharmacy machine or the design is portable. We can take it and put it in a spaza shop, we can put it in a church, and people will be able to access their medication. So it's a concept that probably will be the future of chronic medicine dispensation, and also it will not only support future pandemics, but also it's contributing to prevention of climate change. Remember, when we go to facilities, we take taxis, we eat along the way, we litter, but with e-pharmacy, we just go in, take our medication, and leave. So it's future for medication dispensation, and we are looking forward to Beyond Zero rolling e-pharmacy more for access to our communities. Thank you.
Great. So, Miss, I'm worried about transportation of this chronic medication, right? Understand the system. There was a beautiful answer. I liked it. Now it's understandable. But now, in terms of delivering, remember, COVID, we couldn't travel, and we couldn't gather. But how do we have a plan in how we can still dispense this medication despite all these issues? That's point one. And point two, what have we considered as a transport mode for this medication? I'm sorry, I'm asking this because, are we speaking a mobile vehicle? Are we speaking a train? Are we speaking helicopter? How does it work?
Drones. So there's different forms of e-pharmacy, but this particular one that we are piloting at Beyond Zero, it's a courier service. So your medication gets delivered at your doorstep. So your script gets shared with the people that are with a courier service. Let me put it like that. So you go to the doctor, you get assessed, you get a script for 6 months. Then your script gets into e-pharmacy. Then they will dispense every month for 6 months. Your treatment will be dispensed at your doorstep. So that is one form of e-pharmacy. You also get ATM dispensers that are also e-pharmacies where you can then just go into a container and collect your medication. So future, we're going drone delivery. That's where we're going. So watch the space.
Wanswara, ke botjho jwalo ka drone. Gata. Delivery.
Delivery of the medication.
Successfully
The neighbors
delivered.
don't even see it coming.
Right. One last question. We are aware that crime is a thing in South Africa and car hijack is a thing in South Africa. And car hijack for courier services is a thing. So, now, I have art. It shows address 1081 Sereko Street, Muntiwa, Mafikeng. Name, Lebo Molax. We get hijacked. As we get hijacked, Haibo ke, batati artiam. Haibo, Lebo Molax, se hijackile. ARVA, ere hijacking. Any iya ko Lebo Molax. What are we, is there a way, like I said, I think it goes back to what you were saying, Mudise, or rather what you answered to. Confidentiality in this, how is it maintained? I know it's not that easy, but is there a way, will they know what's in there? Will they know who it is going to? Considering that we took it from, for example, Rainbow Seeds, and they know Rainbow Seeds, that's where people get prep and art, Now they know they took something, they don't know what that is. And here's a package, and it's going to my address, and maybe my name is there. And then, yeah, it happens.
Yes, it happens. In a case of unfortunate situation where that happens, we do have a way of protecting our clients. Remember, this is electronic, so it's not on paper. Lebo, I think you're disappointing me. You have not received your parcel and you sign electronically on an iPad when you still want paper.
I have.
So that's where we are. So information is not printed on the box.
That's what I needed you to tell these people.
Yes.
Because the
Information
question I
is not
asked someone
printed
else could have asked.
on the box of your medication. The driver has a barcode. He scans the barcode. You sign if you have to sign on the iPad, and that information is protected. So we're going with the times.
Can I rest assure you that I knew it? It's a podcast. This information is meant for people. This information is meant for people who are listening, whom we are teaching. Me and you understand all this.
So we use barcodes.
Yes.
You use unique patient identifiers.
I like that. Unique
So
number
we don't deal
or
with
identity
people's
number or
names
something.
and
Thank you.
We scan and information is built into the system.
This is the
So
information
even if
that I
you
needed.
steal the iPad that the driver is delivering with, it's not going to help you with anything.
You just get the iPad. You can see that it's 1234000H1, but you don't know what's that. Only you can understand. All right. Is this clear? All right. Ladies and gentlemen, I don't know, Luthando, do you have a question?
Yeah, I just want to go back to the helpline situation. I just want us to go back a little bit. This question is for Dr. Gaga. Do I have Dr. Gaga here? Dr. Gaga.
Dr. Gaga is right here.
Oh, there we go. So the helpline provides psychosocial services to clients around the country. However, the services are not physical. Now, how do you think the helpline is enhancing health outcomes of key populations?
Thank you. Am I audible? Is this audible? Oh, okay. Thank you very much for that question. The helpline is meant to give again the level of confidentiality. Where people feel they do not want to interact in person, it allows them to be interacting with somebody on the other side of the phone. And if they are not yet comfortable with either their sexual orientation, they are still in the closet, if that's still the word that is being used, the terminology, or if they are not yet comfortable with their HIV diagnosis, it allows them to be able to interact with a person remotely. So that's the first part with the helpline. The second part to it is ease of access. You pick up the phone, you are able to get support. You get a counselor on the other side. You talk about violations if you feel you have been discriminated. So you get service. You don't have to wait for the next morning to go to a facility and get a counselor. You get services online immediately at your own demand. So that is the advantage with the call center. The one thing that we are picking up, because I don't want us to sugarcoat interventions and innovations. The helpline came at a time where it is now competing with social media. So a call is not as frequently used as the social media. So we are picking up that there is competition in that space. So we have to find a way of linking the two. Now that is where we are in terms of BZ, because we're picking up that it doesn't matter how much we market, how much we integrate it with the other interventions or innovations within the program, still the pickup in terms of numbers that are being received at the call center is not what we had anticipated. So we are at a stage where we are doing an internal evaluation to say, hey, what is it that we're missing? How do we keep this going? Because it's not been there for a long time, so we can't drop it just because the numbers are not what we want. So we have to go in depth now, exactly what we are doing on implementation science. Thanks.
Okay, thank you so much. Dr. Monyela, I'm looking for Dr. Monyela. Are they in the building? This question is for them. As CSF, what are your thoughts on these innovations that are bringing services that are tailored to beneficiaries with convenience that does not cost them?
For us, our view on that one, it's gonna assist. That's number one. It's convenient, progressive, and it's gonna be productive. Why am I saying that? This is because, those are kind of services that as civil society, through all the sectors that we've been fighting for them to happen in our communities. Remember, the whole idea of us strengthening civil society forum, it's for us to do advocacy. So we've been fighting and proposing for these programs to happen, particularly on the young people, because we've been preaching that young people are the leaders of tomorrow. But can we then take care of creating a safe space for the leaders of tomorrow? So as and when they are able to take charge as leaders, then we are certain that leaders that are taking charge, they are indeed familiar with the programs that the communities want, the programs that are serving for the best interest of the community. So what is key on the process, we're saying, as the civil society, are too much appreciative to the project and the program, we are going to support the program. As much as I'm saying, it has been the idea that we had throughout. The question of how do you start what, it was not that much of an important thing, but the issue was to see the programs happening. And as much as we are saying, we want young people to take lead, but we need to make sure that we create a space where very same young people are protected, are safe. So we are saying with that project, that innovation, it's highly supported. And we are going to be part of that in making sure that we remain the voices of the voiceless in our communities. Remember, civil society is just there to serve in the best interest of our communities. And indeed, we are behind that project. Thank you.
Thank you so much. Thank you. And I do have a question for Miss Q on the floor with the Unmute Me program, the Unmute Me campaign. Earlier, I asked her questions about her campaign. Because I am a trans man as well, I felt a little bit close to her as a trans woman, and I sort of appreciated the information that she gave me, which in a nutshell, by the way, I might not be doing her campaign any justice, but in a nutshell, it's basically giving a voice to the voiceless, or rather unmuting the voiceless, right? So I would like you to tell me how you go about unmuting the voiceless, how you go about doing your work, and if you have received any feedback, what kind of feedback was it?
1 2 1 2. Thank you for the question. I think first and foremost, we need to talk about the premise of the campaign Unmute Me. It comes from the background or the knowledge that recognizes the actions that work against trans persons, like the experiences around social erasure, where transgender people in our societies, they are treated as a constellation that should not exist. In that doing, our voices, they are lost in the mist. We have no saying in the services design that are speaking to transgender people. And these are the services that are not necessarily unique when it comes to transgender people. Oftentimes, I would be talking about the provisions and prohibitions. Let's make an example. If you go to Home Affairs and you are seeking your gender marker change application, which is essentially going to be talking to the change of your ID and perhaps your name if you want to. It's not a new conduct within Home Affairs, because it is something that a cisgender woman would apply for after getting married. You would be applying to change your surname or to include it into your new identity document, which is something that is provided for in the act that guides Department of Home Affairs. Why is it a problem or an issue when a transgender person seeks the same service that speaks to the same act and the same promised service? We take a second example. If you are a transgender man and you are seeking for testosterone, it's something that is freely available for cisgender men in hospitals for various reasons. Why is it impossible for a transgender man to be given testosterone, whereas cisgender men, they can come in at any point in time, they would be given this particular drug? Again, a third example would be, if you are a transgender woman, you are wanting to undergo orchidectomy. As something that cisgender men, for various cancerous reasons, would be afforded that particular service. But if you're a transgender woman, you want to affirm your identity, you are seeking the very same orchidectomy that is performed by the urologist in the hospital, it would be very difficult. So we are coming from that background with Unmute Me to create or to generate the experiences of transgender persons, to inform, one, our programming, two, to ensure that the voices of transgender, they are not lost in the mist when we are doing our programming. We use them to inform what we are doing so that our services, they are responsive to the needs of transgender persons. I hope I have covered your question.
Oh, more than that. Thank you so much. Thank you.
Great. So from the crowd, do we have anybody who is a beneficiary, who has a story to tell, whether through a Me First program or Unmute Me? If you have a successful story, is there anybody who can tell that, look, I'm a beneficiary of this program? Unmute Me, whether transgender or Me First, MSM. Is there anyone? Anyone going once? Beneficiaries going twice? It's gone. Right. So we do understand that we have Beyond Zero, which is an umbrella. And Beyond Zero has these programs, right? Unmute Me, Me First, Say It, Talk About It. Is it Say It, Talk About It? Say It, Let's Talk, right? And then we've got Human Rights and Advocacy, And then, like I said, we've got community systems strengthening. I am more interested in the implementers, because we have now implementers of these programs and we have beneficiaries. As an implementer, ma'am, are there any challenges you are facing to achieve the goals that are meant for these programs?
Wow.
Rose, yes.
Wow, there's quite a lot of challenges at times. It can be probably, the basic one would be weather conditions.
Okay.
It can affect when you have to go out. Then sometimes we just had recently an incident where we had to implement an event in the area, and then the chief wanted us to pay him before we bring services to the village. So these are the type of challenges that you face on a daily basis. So just to mention like two of them, understand? And then luckily for us, we reported the incidents, and then the chief came back and apologized because he thought that we were obviously going to take money out of our pockets to pay him.
Imagine.
In allowing us to bring services to the villages. And then sometimes some of the other challenges could be, besides the weather, besides the chiefs, it's also like you have a lot of people that are homophobic within the community. And then your staff safety is at risk when you take services within that area.
Great. And then besides challenges, is there anything that you find perhaps easy then to deliver? You know, we do have challenges, and then we've got convenience that, you know what, it's easier. We are meant to do this, and we are doing it with ease because of support from perhaps the community or any other organization.
You know, one thing I can say that actually speaks to that is when you start with your implementations, mapping is very much important. Identify who are the stakeholders, who are the gatekeepers within the community, and then you communicate with them, you negotiate with them. Likewise with the Department of Health, then you build a relationship with them. They in turn becomes your ally to the program, and it's important to make sure that they are on your side.
Great. Luthando, perhaps do you have any more questions or any comment? You're very satisfied. Okay. Crowd, do you guys have any comment, any question? Is it clear? Remember, today we are speaking three things. Our new innovations. E-pharmacy, the key population helpline, as well as the key population hub, which is in Bloemfontein. I'm hoping everything is clear so far. No comment. I believe no comment. All right. That is it, ladies and gentlemen. What a beautiful way of unpacking information that is. We've been hungry. There is hunger and there's starvation. I think we've been starving to know this information. And I am so glad that we are here today. One more time, my name is Lebo Molax, ladies and gentlemen. Of course, your host with the most, MC with the best, TD Boza MC. And as I've said, today was all about Beyond Zero and their innovations. And we would like to encourage you to please call our helpline, our Key Pop helpline on 08,000 60038. This is where you will get all the help you need. If you want confidential services, if you don't want anyone to put a face to a name, but however you need our help, please do contact us. And as we've said, we do now have e-pharmacy, which is where you will be getting your medication right at your doorstep. Do not forget that we also have a key population hub, which is situated in the city of Roses, Bloemfontein, the heart of it all, right in the Free State. With all that being said, ladies and gentlemen, we are looking forward to seeing you again.
This podcast is brought to you by Beyond Zero for its adolescent and young people's program, Men Who Have Sex with Men program, and Transgender program. We are Beyond Zero.